Good morning, everyone. Thank you very much for invitation. Good morning to everyone who arrived to Warsaw and those online. My name is Ewa Nowacka. I work in Department of International Cooperation in the Ministry of Health. I am also the WHO national counterpart, so you can expect that I am more into global than regional cooperation in health. But first things first. Yes, Polish presidency in the Council of Europe. The motto of Polish presidency is Security Europe and is health security. Here you can see the EU presidency priorities of the Ministry of Health. I will not tell the details on each of them, but I wish to emphasize the main ideas standing behind them. Okay. Prevention and health promotion. On this priority, the idea is to develop a catalog of good practices and the assessment of the effectiveness of preventing healthcare. Here, I would like to draw your attention to the presidency opening conference, Together for Europe's Health, Strategic Orientations and Actions for Public Health, which provided a forum for sharing knowledge and experiences. Participants agreed that further international cooperation in health promotion, disease prevention, and child and adolescent mental health is essential. Mental health of children and adolescents. Under this priority, we have been working on the Council conclusions, which aim to establish a common framework for action in the area of children's and adolescents' mental health. The conclusions are to be adopted at the nearest EBSCO. Digital transformation of healthcare. Here I would like to draw your attention to the issue of European health data space regulations, which will enter into force in March 25. At all these meetings, the best way of implementing EHDS, both at the European and country level, was discussed. The medicine security. In this area, the most important work has been done behind the curtain. This led to the consensus on the reform of the EU's pharmaceutical sector. On the 4th June, the Council gave the Polish presidency the green light to begin negotiations with the European Parliament, and the trilogues start this week. Of course, we organized an informal EBSCO in Warsaw on the 25th March, and the formal EBSCO will take place in Luxembourg on Friday. I would like also to draw your attention to the special intersectoral conference organized under the motto of Polish presidency, Security Europe. The meeting took place on the 8th of April in Krakow, and the participants agreed that health is no longer solely a domestic matter of EU member states, and it must be seen as a strategic, cross-sectoral and collective issue. They discussed key global health threats, which require international cooperation and swift responses. In the context of a shifting security environment and lessons learned from the war in Ukraine, the importance of building resilient healthcare system capable of operating during crises and conflicts was stressed. Now I would like to say some words about Polish engagement on the global level. And here you can see some examples of recent Polish engagement. Last year, after 25 years, we joined the WHO Executive Board. My boss, Katarzyna Drążek-Laskowska, has become the member of WHO EB. Within its frame, she's also a member of the Standing Committee on Health Emergency Prevention, Preparedness and Response, which was created in 2022. And this year, she was asked also to join the Program Budget and Administration Committee. Last year, no, it's still this. Last year, we were also re-elected to the Commission on Narcotic Drugs for another 3 years term. And this task is performed by National Center for Prevention of Addictions. And this year, the National Center for AIDS has started a 2 year term in the UNAIDS program coordinating board. I would like also to draw your attention to the ECOSOC and humanitarian affairs segment. Last year, we introduced the health issues in their works. We organized a side event on the role of international society in medical evacuation during emergencies. And this year in Geneva, the side event on protecting healthcare against attacks is to take place this week. There is also one more thing I would like to draw your attention to. This is the high-level process on TB conducted in conducted in the UN. In 2022, we were honored together with Uzbekistan to co-facilitate the process on TB, which was concluded by the adoption of political declaration on TB at the UN high-level meeting on TB in 2023. And TB has become also our WHO EB membership priority. These activities are in line with the global health strategy and guiding principle. Now I would like to refer only to some of them. To improve equitable access to a full range of essential health services. Poland has been engaging to improve the cooperation and by this diagnostic and treatment of communicable diseases, especially TB and HIV/AIDS. In 2023 and 2024, we organized a TB-related side events during WHA, and this year Katarzyna gave a key statement at such a meeting. We believe that this disease is preventable, it is curable, and we can actually eradicate TB in the world. Last years, we've been also paying special attention to mental health. We continue supporting the works on mental health and psychosocial support technical working group led by WHO country office to coordinate the aid to Ukrainian refugees in Poland and hosted communities. In 2023, we have organized a mental health forum. Next was organized in Geneva in 2024, and another meeting is taking place now in Paris. May I remind you that mental health of children and youth has become one of our presidency priorities. On the principle on fostering digitalization, Poland uses its best experience in e-health, like internet patients account, e-prescriptions, e-referrals, and telemedicine, to support the implementation of EHDS and implementing such solutions at the global level. As we were one of the pilot countries using the EU Digital COVID Certificate, now we are joining the WHO's Global Digital Health Certification Network. Health digitalization is one of the priorities of our EU presidency, as well as of our WHO EB membership. For this guiding principle, we are very active at different levels of cooperation, using experience gained during COVID-19 pandemic, the refugee crisis of 2022, as well as the acknowledging the risk of being attacked. We support the synergy among EMT initiative, WHO Europe Partners to Zero, and EU strategies and actions. And we work to ensure that these strategies and activities are compatible with each other. We welcome very much the cooperation between World Health Emergency Team and the Union Civil Protection Mechanism. By today, 19 Polish experts have taken part in the mission organized by WHO with the support of UCPM. And about MEDEVAC pattern, I will tell you more later. And now, guiding principle 14. In the frame of this principle, well, we work in WHO at different levels. This year, we had exceptional opportunity to ensure that EU common statements have been presented with a very strong voice at different levels of WHO. The voice was doubled as we were both the EU presidency and WHO EB members at the same time. And now coming back to MEDEVACs, which is one of my favorite issues, showing not only the global health strategy in action, but also the solidarity of international society at different levels. Moreover, MEDEVACs is a solution which can be implemented everywhere in the world, like it is in Gaza Strip, and it is a model to be used in any emergency situation, like it was used in North Macedonia after the fire in a nightclub. This is sustainable and scalable solution, both for long and short-term crisis. This is how the pattern of medical evacuation from Ukraine looks like. And this is the very first achievement, because in the first months of the Russian war in Ukraine, the MEDEVACs were chaotic, done case by case, performed by different actors. Now the system is consistent. Well, no, actually we have the system. It is coordinated by UCPM, where all the requests from Ukrainian side are gathered and shared with the other states. After receiving an offer and agreeing on the treatment, patients are transferred to Lviv, where the main MEDEVAC hub, Ukrainian MEDEVAC hub is located. Then from Lviv, patients are transferred in convoy to Rzeszów-Jasionka. This way, our transferring patients facilitates the border crossing. In MEDEVAC hub Jasionka, the patients stay overnight, and next day they are transferred to the airport and taken to the destination countries by a Norwegian airplane, medical airplane. The repatriations of the patients after they finish their treatment is done with the support of WHO Euro. Here you have some numbers. The patients registered in the UCPM system are not all evacuated from Ukraine. Also non-participating countries like United States or Canada host Ukrainian patients, but still it is almost 4,500, and almost 4,000 of them traveled via MEDEVAC hub Jasionka. MEDEVAC hub Jasionka has been officially opened on the 1st of September 2022. In general, it increases the safety of relocated people by providing accommodation and care to patients and their family members in the event of delays caused by weather conditions or other unforeseen events. It allows for better planning of the MEDEVAC process in coordination with the Ukrainian and Norwegian side. It consists of 40 inpatient rooms with basic medical equipment, ensures 24 hours medical assistance and monitoring by experienced medical staff. Patients are retriaged there. They receive necessary medical assistance and psychological support, and also are informed about the destination country and airport procedures. The coordinated checks-in and initial security checks are also done there. This is one of my favorite slides, I have to say, because it shows the engagement of various stakeholders in building the system. The idea and standards of procedures have been developed together by WHO, Euro, and the EU, especially DG Sante and DG ECHO, with the support of Ukrainian and Polish Ministries of Health. Coordination of the process is performed by Ukrainian Ministry of Health with the support of WHO Euro and by Polish Ministry of Health through the plenipotentiary of the Minister of Health for Ukrainian patients. Transfer of information and coordination of the process between Ukraine and treatment offering states is performed by ERCC system, and the transfer of patients' data by a MEDEVAC module of EWRS. MEDEVAC hub Jasionka is managed by Polish NGO, Polish Center for International Aid, PCPM, is financed by DG ECHO, has been equipped by IOM, WHO, UNICEF and Norway government, and is supported by Polish Ministry of Health and Rzeszów local governments. Medical air transfers are provided by Norwegian government, co-financed by DG ECHO. Treatment of patients is organized mostly in EU member states and UCPM partnering states. And repatriations is coordinated by the WHO Euro and financed by the EU. At the beginning by DG NEAR and now as of July this year by DG ECO humanitarian part. As I have already told, the system is not only safe, sustainable and efficient. It is also universal and can be implemented everywhere in the world during different crises and emergencies. So far, Polish MEDEVAC experts were deployed in Baltic states to advise on mass evacuation system, to WHO in Cairo to organize the medical evacuation from Gaza Strip, where up to date more than 20 patients have been evacuated to European countries, mostly children. Poland shares the experience and lessons learned to promote the system at different meetings, events, and workshops. We are ready to support the European Commission on the way how to include MEDEVACs to the rescEU system, rescEU pool. So as you can see, despite the fact that Poland does not have the global health strategy, we do engage actively in global health. And that's why I'm very interested about your discussion. I'm staying here today to listen about your experience. And from my side, that's all. Thank you very much.